Welcome, everybody. Welcome to the first episode of the GC Orthodontics Exchange podcast. So my name is Antonino Secchi. I'm an orthodontist from Devon, Pennsylvania. I am the developer of the CCO system. And today I'm very happy to have a good friend of mine and a renowned orthodontist from Tel Aviv, Israel, Dr. Mazor. So Dr. Mazor is the inventor of the FA multi appliance for class 2, class 3 closing spaces. We're going to be talking about how he used it. And Dr. Mazor, welcome to the episode. And please, I would like you to introduce yourself to the audience.
First, thank you very much.
You're very welcome.
I would like just to make a small correction. The name is Mazor, but it's fine.
Okay, good.
Many people get mistake with this. It's not a conventional name in the US for the doctors, for the people to pronounce.
Not a problem.
Yes, well, I am been educated as an orthodontist starting 2007, graduating the Tel Aviv University, and I have my own clinic in Tel Aviv. And I am a teacher at the specialization program. It is an international one, which is in Jerusalem University. I'm practicing mostly orthodontics in my office. But I have a lot of experience because before going to the orthodontics, I've been a general practitioner doing a lot of surgery in general dentistry. But today focusing in orthodontics. And one of my things, which I am keen and very happy to do, it is doing things out of the box, like this appliance that we're going to talk today.
Absolutely. So I know that you have a lot of experience with the multi-FA. So how long did it take you to design the appliance, and what was the main goal of it?
Well, the truth is that the thinking about the appliance, it is something that came from existing, looking and working with other appliances that exist today, understanding the difficulties and the disadvantages of them.
Okay.
And this is what the basic idea to develop something which is like more advanced and more successful.
Absolutely.
It took some time. You know, every development takes time. You have to do the prototypes, then you see the problems, then you have really changed everything. But in the end, it took something like maybe 1.5 years, supposed to be quite fast. But we made the one which is today, I'm very proud to say, is considered to be the number one appliance that exists today for this type of family of appliances.
Wow, that's very, very impressive. So can you tell us more about the versatility of the appliance? Because I know that many appliances like yours are called class 2 correctors,
Yes.
or etc. But I think that you can do more than just class 2 corrections with your appliance.
Absolutely. Well, the name of the appliance is called multi-FA. The FA stands for function appliance. That means we can do many things with the appliance. It's not just correcting class 2 and class 3. This is if I say this is the most obvious thing it can do.
Absolutely.
Because of its design, which is very unique, it is quite difficult quite different from the other appliances. That leads to the fact that we can do with this very many different things with the appliance that other appliances cannot do. For example, we can do closing spaces, we can do opening spaces, we can do extraction cases with this appliance. We can do many things together by correcting class 2 and closing spaces or opening spaces. And the very interesting part of it is the philosophy that comes with the working with the appliance. We can combine it with aligners at the same time. We can combine it with brackets in the same time. So the versatility of this appliance is quite big if you compare it with other appliances that exist today.
Nice. And you can use it only on the right side or the left side for asymmetric cases, for instance?
Yes, absolutely. This is one of the philosophies that we have that working with the appliance, that you can combine the appliance with brackets. So you can put the appliance on one side, which is the malocclusion needs to be corrected. And the other side, which is not need to be corrected, you just put the brackets and you keep working. And what is nice about the concept, it is that you are doing many things from the start. You don't have to do step by step. I mean, you're combining things together.
That's very nice. So maybe we can open just to show kind of on camera. We have a nice setting here. You can show us the prototype, the big ones. Yeah.
Well, this is the appliance in the big scale, 3D printed. And it shows the characteristics of the appliance. One of the most astonishing and interesting and important features of the appliance is the fact that it is made from two parts. It is telescopic. So the moment I have to bond it on the teeth, I don't have to measure before I do this, like you have to do with other.
So you can adjust it on
It's
the
automatically on the spot. It takes its size. The other thing that is unique for this appliance that it has two joints. One, it is in the front. The other one, it is in the back, which gives us the possibility to bond the appliance in almost every malocclusion, no matter where the teeth are standing. If you look in other appliances, when you have like one canine which is not in the arch, it is a little bit highly positioned, you cannot use those appliances to bond it on the canine. So you have to do it like two steps. Here you can just bond it on the appliance because it has this type of adjustment that is
like
really easy.
That joint.
They work all three together. So what we say, you have 4 axes of movement. This is very unique for this appliance that you can do it with like bonding it almost on any case that you have.
Very nice. And I'm assuming the appliance is available worldwide right now through GC?
The truth is we started it is in Europe. We have the basic starting in Europe, but then later on we came in the US. And I'm very happy to say that we get beautiful feedbacks from the doctors in the US.
Nice.
And I also get one, complaint from doctors from the US. The complaint was, Dr. Mazor, we have problem to debond the appliance from the teeth. It really stays too well on the teeth. What shall we do? And then I just showed them how it should be done easily, and we resolve the problem. So
I'm assuming the bonding is just like bonding a bracket or a tube, same kind of.
Exactly.
Perfect. Great. So, any other comments from the appliance? I know that you use it a lot with aligners too. It's been so typically you start with the appliance at the very beginning, or you first level and then you use the appliance, or how that works?
No. The idea is here. We have the concept is called multi-segmental hybrid concept. Multi-segmental means that you can do many things together, like we mentioned before. But the hybrid means that in the conventional aligner therapy, usually you have a class 2 or class 3, then you will have to do like moving teeth one by one. Posteriorly, it takes a lot of time, many aligners, and a lot of cooperation from the patient side.
Yeah.
So what we do here, it is that we place the appliance at the beginning, but not as a first step. We also give the patients like segmental aligners, very small pieces of the aligner on the frontal teeth. So while we are distalizing, correcting our class 2 malocclusion, at the same time, we're already starting doing the leveling alignment of the frontal teeth.
I see.
So this is a combination of steps. This is what I was mentioning before, which is very important. This is a very unique thing that you can do here. It's not only the correction of the class 2. For example, if you're going to do an extraction case with aligners, you're going to be the same. You put the appliance, and at the same time you're closing the spaces, you're doing your movements in the frontal area. Now, as an orthodontist, we know that patient psychology is something very important. When the patient comes to the office and is complaining about his frontal teeth, this is the aesthetic area. Yes, they say, look, my teeth are crowded, they are crooked, they don't like my smile, stuff like that. When you go only doing aligners, then you start moving teeth on the back first until the patient starts to see anything happening in the frontal area where the pain is there. It takes a lot of time.
Yeah.
Here, when you combine those steps together, the patient from the start starts to see things happening in the frontal area.
So
it is a huge advantage. It makes them happy. It makes them motivated. And they make you like the best doctor exists in the market because, wow, you're doing magics for them.
Yeah.
So this is the idea. And by the way, it works the same also with brackets. I mean, if you prefer to wear brackets, you can put the brackets in the frontal area. This is the different types of the appliance that we have. Here we don't have it for the combination. It just shows the different types. We have 4 different types. This is with the outer springs in order to open spaces with the appliance. Then we have here the regular appliance. This is for the class 2, class 3. It can be bonded, by the way. The same appliance can be bonded in the lower arch. You don't have to use another appliance like you have in other cases. And we have also here the aesthetical form.
Oh, it's nice.
And we have also, and this is unique for the appliance, this is the only appliance in the world that connects to bands from this family. I mean, if you have first doing a step with expansion, or you as a doctor prefer not to have tubes on the molars, you want to have bands from any reason, then we have the form that connects to bands also. So there is a lot of versatility, and it is a lot of options. I mean, it fits every desire the doctor will have wants to do with the
in
appliance.
just one appliance. So
In just one appliance.
when you so the spring comes with the kit, the spring for opening or closing.
Yeah, of course. We have the spring here that you cut the piece that you want, the exact length that you need. Then we have the stops. This is this specific stops over here that you use the key in order to open the stop, activate the spring, and lock the stop. So we have it a set of a spring, the stops, and the special key.
Perfect.
So it just give you the and it can work with the clear side. It can work with
the clear is just a different. It's like a little. Okay, I see. It comes with the kit too. It's like the front part of the appliance.
Yes, because it's telescopic.
Nice.
It has to be telescopic, so we need to keep it like this.
Very nice. Well, going on another topics that I'm interested to see your opinion. And it's been said many times that in today's orthodontic, the wires became like commodity. And we know that wires are not all the same, but many orthodontists, specifically younger ones, they think that the wires are just the wires. So what do you think about wire technology, and how do you think the wires can affect orthodontic treatment and efficiency?
Yes, unfortunately, I'm giving a lot of lectures and I meet this discussion many times. The new generations of the wires are very unique. It's not a regular wire. I mean, the idea behind this new generation of wires, it is to give the doctor the best possible result with one wire. So if you go today and you see the most modern concepts of using brackets, usually it's been addressed more for self-ligating, but not only. The idea is to be, if I can insert from the start a rectangular nickel titanium wire, I'm going to talk about this in a second, I can put a rectangular from the start and exercise almost the same forces like I exercise with a round, delicate, small size wire. So it is beneficial for me. Why? Because, in the orthodontic treatment, we know there are 5 stages. And the second stage, usually it is the preparation for the rectangular step wires.
Okay.
So if I have a very advanced technology of making wires, and the bioactive from the GC, it is one of those wires that presents this type of superior quality. What that means? On the same wire, you can find 3 different zones of force.
Yes.
Because we have in the front like 1 root tooth, and then we have the premolars, which have two root teeth, and then we have the molars, which are stronger 3 roots. So if I can have differential forces dispersed along the wire, basically I can use this rectangular wire from the start. Now, there are a lot of experiments that shows that I can take a 1616 or 1818 or even a 2020 rectangular nickel titanium from this family. This is the bioforce. The force will be exercised on the teeth will be almost like a 014 nickel titanium wire.
Yeah.
So it is huge advantage that I can have like from the start going into the 3rd step of the treatment, orthodontic treatment, I will save time, I will save money because then I need much less wires to change.
That makes sense, yeah.
So
absolutely.
Those type of wires are very highly sophisticated. You cannot compare them with the regular nickel titanium wires. They are by far, it's more expensive to buy 1 pack of wires. But if you really think about it, you have put it for much longer time in the mouth, you get much faster results than using 3 different wires in a sequence.
Yeah.
So why not?
Let's visit.
Yeah, so less visits, of course.
Yeah.
So absolutely. I today must say that the moment I started to use these wires, and I work a lot with self-ligating, and combining with the CCO or with any type of brackets, self-ligating brackets, I mean, it's unbelievable. It became unbelievable.
How long do you keep these wires on average?
As long as needed to get my leveling alignment and already exercising the torque of the wreath going on.
Okay.
It can be like 2 months, 3 months. It depends on the case.
Yeah.
Now, I must also say that there are not many cases that the crowding is so severe from the beginning
Yeah.
that I might start with the rectangular for just one session, but immediately I will go to the big size possible rectangular, these bioactive wires.
Yes. So you mean in severe cases, you might start with a round wire for just a little bit and then go into yeah.
Not because the wire will not work, it's because there is
some notchings that you can create maybe with the rectangle.
Exactly. The wire might be destroyed because of the overflexion of the wire. This is the only reason.
But it's important because there's still people that they change the wires, every 4 weeks or 6 weeks. And it's important to understand that these wires can be in the mouth without any problems for months.
Yes, absolutely. This is correct.
Yeah.
And they still keep working.
Good. You use most of your cases in brackets. You use self-ligation?
Yeah, I have a rule which I teach to all my students. Every case which is not class 1 leveling alignment gets self-ligating brackets. I was giving lectures in China for many years. Yeah. And China, it is a market which is very much money-oriented, cost-oriented. And in the end of the lecture, they understood that taking self-ligating brackets gets in the end cheaper than using regular brackets. Yeah, because the process is different.
The cost really is the chair time. That you have these people in your office. So absolutely. Is there any other technology that you think that you use in your office that have really changed the way that you practice in the last few years?
The truth is, self-ligating bracket and new generation of the wires, this is the two things that really made the difference in my office.
Yeah.
And the combination that we are doing with the multi-FA with aligners or brackets as a concept also made a huge change in my way of working. And I think this is basically the things have a huge influence.
You use the multi-FA in pretty much half of your cases or maybe more?
Every class 2 case
every class 2, yeah.
Every class 3 case I have. Every crowded cases I have. Every extraction cases I have. I use the appliance. And the big advantage is that you can put the appliance from the start. You don't have to go with the wire progression to put the... those 3 things I can say that make huge change in my way of doing work. And what is interesting, because the patient also see the results differently. So, I have patients coming, you gave this self-ligating bracket with this metal appliance. Yeah. I want the same.
Yeah, that's good. Now, I'm assuming you use that also in a phase 1 treatment?
In a phase 1 treatment.
Yeah.
Yes.
So, is there any, since you teach so much, any advice that you can give to the younger generation of orthodontics that because they've been so much exposed to technologies like scanners, printers, CBCTs, but at the end, when you go to your office, still most of the cases that you see, there's still brackets and wires, and it seems like we haven't been talking too much about that, and people are leaving schools right now. Desiring to know more about the mechanics and how the brackets and wire can be used in a better way to be more efficient, I guess, no?
Absolutely. Yeah. Absolutely. I think the young generation, it is the ones that I trust them to be open-minded.
Yeah.
Yeah, you get some tools at school. Sometimes it's very easy to stick to those tools.
Yeah.
And I have a saying, don't be just a fish, be a shark. Open your mind.
Yeah,
try to go out of the box. Try to learn. Try to see other people experience.
Yeah.
Get new ideas. The more you open your mind, I don't think you're going to get confused. It's going to help you better to make your orthodontics better and more successful. You're going to be more satisfied. So absolutely. Going to congresses, opening minds, see new products. Don't be afraid to try. Okay, you're going to like it. Maybe you won't like it, but most likely you're going to like it because if you're going to go and see doctors working in different technologies, you're going to have a lot of ideas you're going to have. And then you can choose your way. You don't need to stick in one thing. Now, this podcast, it is one of these, for my eyes anyway, one of the targets of this podcast, it is to give these young doctors the understanding that don't be afraid. Listen and try. I think this will be a great thing for you. It just can be a benefit. You won't really get, disappointed.
Yeah, absolutely. No, that's a very good advice. Also you do aligners. I mean, how big is the percentage of aligners that you do in your office?
Oh, quite a lot. Quite a lot. We have a lot of adults and kids doing aligners. As I said before, that the way I do aligners, many of our doctors now following this concept. It is the combination with other appliances. Soon you're going to have my friend coming up. I'm talking about the hybrid treatments.
Yeah.
This is the next generation. Hybrid, this is the next, because we know the limitations of aligners. We know how the weak points of aligners, where they have difficulties, where they don't have difficulties, the advantages. And I think combinations. I believe in combinations. That the combination, it's a very important part of success of doing aligners.
Yeah.
So yeah, I do a lot of aligners.
And when you present the treatment modalities to your patients, you present them like a hybrid treatment from the very beginning, so the patients are aware that they're going to have maybe to have braces in combination with aligners, or how do you manage that in your office?
Of course, we show them the possibilities. We explain them exactly what is the difference between the possibilities, and what is my way, what is the truth of my truth of doing things. And I must say that I'm very happy that most of our patients, they understand, they know this is for their own benefit, and they are following these advices like we have they have no problem to understand that if they need to have like an appliance at the first stage or together with the aligners, that we have to put some elastics, you're going to make the treatment go faster and better results, they go for it. I mean, they are coming to have a nice result. And they absolutely will follow our advice. Yes, we're presenting this from the beginning. And we also tell them sometimes, you know, in your case, you might have to have in the end short period of doing brackets in order to finish your case. We know the limitations of aligners.
Yeah, that's good. So we still have a few more minutes before we finish with the podcast. So any other considerations that you want to clarify about maybe the multi-FA appliance for doctors that would be interested in trying? I know that you will be at the AAO, at the GC booth. Are you going to be explaining more, maybe presenting something about the multi-FA appliance at the AAO?
Well, what I have a very good advice for the doctors is go and visit. There is a lot. Visit the YouTube. I have a site in the YouTube. There is huge amount of information over there.
Okay.
All the new concepts. We have a lot of videos over there.
How they can search for the YouTube channel?
Just put my name, Dr. Mazor Yoav. Yes, and you're gonna come up. You can put even the name of the appliance, multi-FA, and it'll come up. There's a ton of materials over there. Very interesting cases, showing you different more things you can do. And it also gives you the step-by-step how to do everything. Now, I'm inviting you all to come to the AO. You know what? I'm also inviting you to contact me after the AO. This is no problem. You can find my contacts in the GC company, and I will be more than happy to introduce, to help, to advise, give you everything you need. And again, I am very proud to be the one who was behind the brain behind this appliance. Not because I am the inventor, because I am seeing the reactions coming from the doctors. They are very happy, they are very satisfied. And when I came here in the US, the first thing I was doing, I was talking with the guys from GC, trying to understand how satisfied are the doctors working with the appliance. And I'm very happy to see that they're all very happy. They're very satisfied. The doctors say they get very nice results very fast. And you know what? Has a lot of biomechanical and clinical advantages because of its unique design. Again, this appliance was based according to our experience in the university and in my own clinic with other appliances from the same family. And we saw the disadvantages, the side effects that we got over there. And that was the trigger to make something which is like based on all these advantages that we have from other appliances. So today, if you go and you see all the concepts that I have developed together with my friends, by the way, I see this work with doctors like an open source. I mean, many doctors call me and says, did you ever think to do that with the appliance? I says, you know what? This is a nice idea. Let's go for it. And we just put it in the protocols later.
Yeah.
When I give a lecture to present the case, the appliance or my cases to other doctors, 50% of my cases, which I put on the screen to the doctor, are not mine. There are doctors sending the cases, and I'm proud to put them on. Yes, because it's not only showing that it's not working only on my hands. It works very well in their hands also. And they are very happy with it. And they keep sending the cases. And I'm very happy to put them on. So what I'm trying to say is, I'm an orthodontist like you are, like the doctors watching these podcasts. And our intention, it is to make our life be easier, a better way to make our treatments get faster and nicer results. And this is the point that this appliance was developed. So this is the way that I'm working with the self-ligating brackets. We were talking about the wires. It is a way that I believe the doctors can do a very nice job and easy without too much complications. And this is, I think, the beauty of this. And I'm happy to share this, and I will be more than happy to share any idea any doctor has. So, yeah.
That's great. So, well, thank you very much, Dr. Mazor, for your time. I'm pretty sure the appliance will be very successful in the US, like it's been in Europe and in the rest of the world. So I'm looking forward to see you in a couple of more days, maybe sooner at the AEO in Philadelphia. So thank you so much for coming to the podcast.
It is my great pleasure. Thank you very much.